Quick disclaimer. Information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Have you ever wondered what the difference is between A1c and daily blood sugar readings? If so, you're not alone. Many people share this confusion, and today we're diving in to unravel and compare the two measurements so you can start using your numbers to get better results.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1c, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jeddah.
Hello, wonderful people. Dr. Jeddah here, and thanks for joining me for episode 74. We have talked about blood sugar levels quite a bit throughout various podcast episodes, but it's always good to take a refresher no matter how long you may have been living with diabetes. It's also important that we cover important blood sugar topics, as I see common questions coming up all the time, and since everyone is at a different point in their journey, I understand all this blood sugar stuff can be really confusing. For example, Lisa asked, what is A1c? And while that may seem like a silly question to some, there is no such thing as a silly question. If you don't know, you don't know until you know, right? So never think any question is silly. In fact, if you have a question, please send it in for a future Q&A episode. You can head to type2diabetestalk.com/message, and I'd love to hear your question, as I'm sure all our listeners would too, as we always draw valuable insights from the questions people send in. So head to type2diabetestalk.com/message to leave a voice message or send us an email. So getting back to the topic of today, Lisa asked, what is A1c? And we are going to cover that. Rock said, this article mentions reducing A1c from 10% to 7%. It also mentions metformin can reduce A1c by up to 1.5% at maximum dosage. I didn't think A1c was a percentage of measurement. Please explain. So we're going to talk about the different A1c measurements, as unfortunately these can be different depending where you live. Mike said, I don't understand my daily blood sugar readings and how that's different to A1c. This is another common question we get, and we'll be diving into that today. Georgina asked for advice about her numbers, sometimes being 7.6, another time 9.8, then 6.7, then 5.2, and feeling confused about what any of it means. Worst of all, she asked her doctor to explain things and got pretty much no response, but said she was getting fobbed off, which of course is not good, and we certainly don't want you to feel confused because these are very good questions. Just know you're not alone in this. We've had many members who've had diabetes for 20 years and still haven't fully understood what their numbers meant and how to use them to get better results. Unfortunately, most doctors aren't great at explaining these things to you, which is why we love covering these topics on the podcast. And of course, we have a ton of resources inside our members site for members all about this stuff. And you know, everybody's at various stages of the journey, whether that be at risk of pre or T2 diabetes, whether that be newly diagnosed or living with diabetes a long time. All of these questions about blood sugar are important. So importantly, always ask questions, because that's the only way you can understand your numbers and your health, so you can be proactive to change it if you want or you need to, of course. In any case, we're going to address this thing Georgina was confused about as well, and that is the issue with blood sugar fluctuations. Firstly, for those who might be newly acquainted with the realm of diabetes, those newly diagnosed, you might hear the terms blood sugar and blood glucose used interchangeably. These are exactly the same thing, just different ways of expressing the same concept. So whether someone mentions blood sugar levels or blood glucose levels, rest assured they're talking about the same thing. Blood sugar, also known as blood glucose, is the amount of glucose circulating in your bloodstream at a given moment. With pre- and T2 diabetes, your blood sugar levels serve as a key indicator of how well your body is processing glucose or sugar. Remember, these are the same thing. Also, depending where you live, blood sugar levels are measured in units like milligrams per deciliter or millimoles per litre. We always share both measurements on the podcast since we have listeners and members from all over the world. So monitoring blood sugar levels provides immediate feedback on how your nutrition and lifestyle are affecting your body. The two most common times to check blood sugar levels are fasting. This is your morning readings before eating. And this reading helps establish a baseline for the day. And the other most common reading is 2 hours after meals. That's called your postprandial readings. These measurements show how your body is managing the food you just ate. Many people use a glucose meter that performs a simple finger prick to draw a small amount of blood to get a test result, and some people now use a continuous glucose monitor to measure their blood sugar. And these tools provide real-time data to guide your decisions. I'm not going to go too far into the detail on the specific numbers on this podcast. Yes, we'll cover them briefly, but not in detail because we've covered normal blood sugar levels and goals in episode 11. So after listening today, go back and listen to that episode as well because it will really reinforce things once again. In brief, a normal fasting level, remember that's your morning reading, first thing when you wake up before you've eaten anything. The normal level is 70 to 99 milligrams per deciliter or 4 to 6 millimoles per litre. After meals, a normal postprandial level is under 140 milligrams or under 7.8 millimoles per litre. So your blood sugar levels may be higher than this now, but over time, these are your goals to get your levels within this normal range or as close to the normal range as possible. And reaching these targets consistently indicates optimal blood sugar management and reduced risk of complications. Now, something that comes up quite a bit is confusion about numbers being all over the place. So here's the thing. It is normal for blood sugar to fluctuate. That happens for everyone, whether they have diabetes or not. Blood sugar levels are dynamic, constantly shifting based on various different factors. Our diet, for example, what and when we eat has the most immediate impact on our blood sugar levels. For example, foods high in carbohydrates cause bigger spikes. Exercise, physical activity, helps lower blood sugar by increasing insulin sensitivity and encouraging glucose uptake by muscles, but sometimes it can cause a temporary rise in blood sugar. Poor or insufficient sleep can disrupt hormonal balance, leading to higher levels. Emotional or physical stress triggers cortisol, a hormone which can elevate blood sugar levels as well. And illness or medication, so being unwell or taking certain medications, can also impact your numbers. So there are lots of things that can influence our blood sugar levels on a daily basis. And remember, blood sugar levels are dynamic, so these fluctuations are normal. But the goal is to aim for those normal target ranges as much as possible, keeping your levels in the normal ranges. And over time, patterns in your readings can provide valuable insights into what's working and what might need adjustment. So daily blood sugar readings offer a real-time snapshot of how your control or how your body might be responding to different things. For example, if your post-meal reading is higher than your target, you can adjust your portion sizes or your food choices the next time to get a better result. And similarly, if you see stable readings after a new routine, like adding a short walk after dinner, it's a sign that that change is helping. So monitoring your levels gives you immediate feedback that you can use to your advantage. The important thing is, if you notice readings that are higher than they should be, don't panic. Readings provide useful information to you so you can make adjustments. That's why daily readings are so useful. By focusing on these daily numbers, you can make proactive adjustments to your nutrition and diet, exercise, and overall lifestyle. And of course, medications and certain other things if necessary. So what about A1c? What is that? A1c, also referred to as hemoglobin A1c, HbA1c, or glycated hemoglobin, this is a blood test that provides an average of your blood sugar levels over the past 3 months. It's a key marker used by your doctor or your healthcare providers and yourself to assess your long-term glucose control. So here's how it works. Hemoglobin is the protein in red blood cells responsible for carrying oxygen. And when glucose enters your bloodstream, it attaches to hemoglobin through a process called glycosylation. And the A1c test measures the percentage of hemoglobin coated with sugar, glycated hemoglobin, or in more simple terms, the amount of sugar on the blood. And since red blood cells live approximately 3 months, this test reflects an average of your blood sugar over that time frame. A1c offers you a broader picture of how things are going. Unlike daily blood sugar readings, which show immediate and often fluctuating values, the A1c test provides a more stable and comprehensive view of your blood sugar control. Yes, we can lower it quite quickly. I mean, if it's up at 10%, we can get it down to 7% or 6% relatively fast in a few months. But overall, it's more stable. It doesn't go up and down from day to day. So it averages both the highs and lows of your daily readings, offering a more objective measure of how well you're managing your blood sugar over time. And here's the thing, if you're monitoring your daily levels at home, you can see a difference in your blood sugar numbers within a few days, even one day or one meal, if you know what adjustments to make and what numbers you're looking at. For A1c, that's not the case. You can't influence A1c by changing one meal because it's the average of your blood sugar over that 3-month period. Yes, as I just mentioned, you can influence A1c. Of course, you can bring it down if it's high, but you need to allow a few months to see a noticeable difference. Let's talk about A1c numbers, which is also another area of confusion because these are measured differently all around the world. This is really so frustrating, but that's the way it is. So let me explain this. The results of an A1c test are most commonly given as a percentage, and the normal A1c range is set at 4 to 5.7% in the US and 4 to 6% in most other countries. In the UK and some other places, doctors will report your A1c test using millimoles per mole. So for A1c, a normal level is under 42. With type 2 diabetes, your initial target is under 7% or under 53. So this is the level you're working towards. If your levels are higher, then you want to work toward a level under 6% or under 42. For prediabetes, you're ideally aiming for an A1c level under 5.7% or under 39. So this is a normal A1c level. For both T2 diabetes and prediabetes, you want to be aiming for normal ranges or being as close to those normal ranges as you possibly can get. So knowing your A1c helps you gauge the effectiveness of your overall diabetes management. Your A1c level also helps you understand your risk of long-term complications such as nerve damage, eye problems, or heart disease. Because research shows us that lowering your A1c by just 1% can significantly reduce these risks. And even lowering A1c by 0.1% can reduce risk of complications. So don't undervalue any progress you make. It's all valuable. Any reduction in your blood glucose levels or your A1c levels is incredibly valuable.
With Dr. Jetta's VIP online membership, you'll have proven, practical support to lower blood sugar, weight, and medication. Access detailed guides to understand exactly what to eat. Explore the huge members library. Browse thousands of easy, diabetes-friendly recipes. Use the health log to track your progress and improve your numbers. And join monthly member check-ins for personal feedback and trusted support whenever you need it. Join as a VIP member today. Visit type2diabetestalk.com/programs.
Now that we've cleared up what blood sugar and A1c is and the normal target ranges, you may still be wondering, well, how do A1c and blood sugar relate? The A1c and daily blood sugar readings are interconnected. If you maintain good control of your daily blood sugar levels, keeping them within target ranges consistently, your A1c will naturally improve. On the other hand, frequent high blood sugar readings will cause your A1c to rise. That's a simple equation. High blood sugar readings on a daily basis equals high A1c levels. Lower blood sugar readings on a daily basis equals lower A1c levels. It's important to note, however, that A1c is not influenced by short-term spikes or dips in your blood sugar. For example, if you had a few high readings due to stress or illness or a higher sugar meal, it's unlikely to significantly impact your A1c unless those highs are consistent over a week or weeks or months. So by using the A1c test as a long-term marker and combining it with daily blood sugar monitoring, you'll have a clearer picture of where you stand and what steps to take to stay on track. So let's clarify the key differences between blood sugar and A1c. Daily blood sugar reflects the glucose level in your bloodstream at a specific moment. It can vary throughout the day, influenced by meals, physical activity, stress, sleep, medications, and other things. The purpose of daily blood sugar readings is they provide you with immediate feedback, helping you make real-time adjustments to your nutrition and diet or other lifestyle factors. For example, a post-meal reading can indicate how well your body handled the food you just ate. A1c reflects the average of your blood sugar levels over a 3-month period by measuring the percentage of glycated hemoglobin, sugar-coated red blood cells, effectively, and the purpose of A1c is to offer you a long-term view of your blood sugar management overall, accounting all of your daily blood sugar readings collectively. An A1c test is less affected by short-term factors like a single meal. Unlike daily readings, A1c is more stable and serves as an indicator of your overall blood sugar management and your risk of complications. So for comparison, daily blood sugar is your immediate real-time snapshot. A1c is your average over 3 months. Daily blood sugar can be tested multiple times a day using a glucose monitor at home or a CGM. A1c is tested every 3 to 6 months via a blood draw, usually ordered by your doctor and conducted at the pathology lab. Daily blood sugar levels fluctuate daily. A1c levels are stable over time. Daily blood sugar is very useful for that immediate feedback to make those short-term adjustments, and A1c is a long-term progress assessment. So both of these types of measurements are important and useful. Blood sugar helps you make quick, actionable changes to manage your condition on a daily basis. For instance, again, if you notice those high post-meal readings, you can adjust portion sizes or the types of food you had in your meal. A1c serves as the big picture marker of your glucose control and indicates how effective your overall management plan is. It also predicts your risk of those diabetes-related complications. But A1c doesn't account for variability, which is why it's still useful to monitor daily readings. And together, daily blood sugar monitoring and A1c testing really complement each other. Think of it like this. Blood sugar readings are individual puzzle pieces while A1c is the completed picture. and both are essential for understanding your progress and guiding your next steps. Before moving on to highlight one thing to focus on for better A1c results, let's hear a testimonial from one of our members.
Jeff said, "I am so grateful I took part in the program. For me, it was truly life-changing. Not only was I able to bring my blood sugar levels down from 6.6% to 5.6%, my readings have stayed down no matter what I eat. I also have the tools and knowledge about how to make sure I don't push the envelope too far. So thank you so much for your program. I have recommended your guidelines to many people as they've helped me so much."
Now, earlier in the podcast, we established the two most common blood sugar measurements most people take are fasting in the morning and after meals, those postprandial levels. I do want to add an important thing here. Most people measure only fasting blood sugar levels, and often doctors recommend this test, which can be very confusing for people. Yes, seeing how fasting levels are travelling over time is important. They can be more simple to measure because you take them consistently first thing in the morning, which makes remembering to do it easier. But one major downfall is that morning levels are often high in pre and T2 diabetes, and they can be one of the last measurements to come into the normal range. So it's better not to worry yourself about these numbers because it can be incredibly frustrating for people to see that these numbers are consistently high. So when it comes to A1c, your after meal levels are actually more important. If your after meal levels are tracking up around 190 to 200 or 10.6 to 11, your A1c is going to be around 8.5%. If your after meal postprandial levels are up at 180 or 10, your A1c is going to be around 7.5%. Now, if you're aiming your target range for your after meals under 140 or 7.8 after meals, that's the normal range, then your A1c is going to come down over time within the normal range, under 6%. So there is a direct connection and relationship between A1c and after meal postprandial blood sugar levels. So if you focus on that, you're going to make a lot more progress in terms of your A1c. So remember, you want your levels 2 hours after meals, your postprandial levels to be under 140 or 7.8. Now, for those of you in the UK who might still be confused about these percentages, we will provide some more resources on the website, the target ranges, and some comparisons alongside this episode 74. But overall, I hope this episode has helped clear up the confusion around these important measurements and given you actionable insights to start using your numbers more effectively. Remember, daily blood sugar readings provide you with immediate feedback to guide your decisions, while A1c gives you a long-term view of your overall progress. And together, they help create a complete picture of how things are going for you and whether you need to be more proactive with your nutrition and lifestyle. And importantly, start focusing on your after meal postprandial levels, keeping them in the normal target range, and you'll definitely see better progress with your A1c levels. If you still have questions, head over to type2diabetestalk.com/message and we'll be sure to include it in a future Q&A episode or to cover it as a topic. Remember, you can find more resources alongside episode 74, and for members, you can find all the resources and some really great blood glucose charts and resources inside the members library alongside episode 74. That's all from me today. Until next time, take care of yourself, stay consistent, and know that every step forward is a step toward better health. Dr. Jetta, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.